Hello, everyone. It's nice to be back with you. I'm Dr. James Marcum, and many of you have been watching this channel for a while. And today we're going to talk about a new treatment for hypertension, that's high blood pressure, and congestive heart failure. But before we talk about that new treatment, I want to let everyone know that we try to have a balanced approach to medicine and healing, looking at modern medicine, which we're going to do today, and where it could be applicable to different people's lives, as well as natural ways that we can stay healthy and prevent especially chronic disease. But we want to focus everyone on Christ as the ultimate healer. So with that in mind, I want to let you know that we do not believe in selling products, even though we could. We don't believe in having outside advertisers, even though we could. We just want to give you good information, let you think about it, and based on your belief system, use this not only to help yourselves, but to share with others. But we always want to start with a biblical text, something to encourage us and also to remind us on what the big picture is as we look along at all of these smaller things that are going on in the world. And this text today is from Psalms 103, verse 19. The Lord has established his throne in heaven, and his kingdom rules over all. God is sovereign. So with this, let me introduce you to this new technology that you're going to hear about in the future. And I'm probably going to have to do this in two parts today because it's a little bit too much to cover. And I just want to give you the basics, just like I wanted you to be aware that we're going to have nanobots in the future. Many of you also heard of other technologies that are going to come out there that we need to know that's out there that exists. And this new technology is basically called a Baroreceptor, and it stimulates what we call Baroreceptors. And Baroreceptors are part of the neurological system that basically signals data on each beat and pressure and volume in the heart, and it helps regulate hormones. You've heard of the sympathetic nervous system. That's the kind that makes epinephrine and cortisol and gets you going when you have to. And then the parasympathetic balances that. Well, baroreceptors specifically help stimulate the opposite of the sympathetic nervous system. It helps turn on the parasympathetic nervous system. And we have baroreceptors at different places in the body, but now they're developing a new device called a barostim, and basically it has a monitor and it stimulates baroreceptors on this to change their hormonal balance. And why is that important? And I'm going to give you why it's important today a little bit, and then next time I'm going to tell you about who might benefit, what's out there, whether it's ready to go prime time or not. But it's used for the treatment of heart failure. So whenever a heart doesn't work well, fluid tends to back up, the organs don't get perfused with oxygen, toxins build up in the body, things like that happen. And usually the heart can either be weak for some type of reason or it cannot squeeze effectively. So the first thing we do when a person is having heart failure is make the diagnosis, because many things can mimic heart failure. Once the diagnosis is determined, we want to know, why is the heart failing? Is it a strong heart? Is it a weak heart? Is there problems in the arteries? Is there problems with the rhythms of the heart? Are there problems with the valves? Has some foreign object infiltrated the heart, like iron or amyloid or something like that? Is the heart muscle, being overworked by hormonal abnormalities like an overactive thyroid? Is there infection going on in the body? Is the heart just worn out from stress and anxiety? We call that the broken heart syndrome. There's many other different reasons. Is the heart muscle just thickened from high blood pressure or being stiff through the years? It might be strong, but it's not filling up well. So the first thing we do when we find a failing heart is identify why, and do everything we can to fix the why. Of course, blockages in the arteries are very common, and we can help with that with bypass surgery sometimes. Sometimes we can put in stents, sometimes there are medicines, and sometimes there's lifestyle things that can be done as well. So we want that approach first. But then after we've done all of that, sometimes we're left with a weak heart, and we want that heart to become stronger. So after we work on all of the different things that we can do to help the heart, we usually try to block hormones that hurt the heart. And we found out over time that hormones that turn on the sympathetic nervous system, the stress system of the heart over long periods of time, make the heart weaker. It can damage the heart. So treatments thus far, once we get at the cause, have focused on making the heart not work as much through turning down some of these hormones that damage the heart. You might think of it like you hurt your knee. Well, if you hurt your knee real bad, we of course do everything we could to fix the ligaments, or sometimes we put in a new knee. Then if we couldn't do that, we do things to make the knee more stable, make it not work as hard. We'd put a brace around the knees to help support the knee. We would maybe help it with some stretching exercises or movement. So even though we couldn't fix it totally, maybe we could prevent further damage and help it somewhat perform better. Well, that's what we're doing with the heart when it's weak. And you might have heard of some of the medicines. Some of the medicines out there are beta blockers. Carvedilol is very popular. That blocks adrenaline's effect on the heart. We have ACE inhibitors, angiotensin converting enzymes. Those help block angiotensin. Those are other hormones that we found if we block those, we help the heart get stronger and slow down damage. Aldosterone antagonists, there's one that we use a lot out there. We use those a lot to block aldosterone. There's one called Entresto that also blocks hormones which damage the heart. Sometimes if the heart doesn't work so hard, we rest it. Of course, we try to exercise it the appropriate amount of about what we can do for depending on what the heart is. We try to move it some. There's other medicines that we use, one called digoxin that helps it beat a little bit better. Sometimes we also use medicines that help take fluid out of our body so the heart doesn't have to work against so much fluid. But all of these usually block hormones, make the heart work less, lower the blood pressure so it doesn't have to push against all of that pressure. And usually so far we've done that with medications. However, the negative thing about medications is sometimes all medications come with some side effects. Also, some medications work better in other people and worse in other people. And then sometimes the belief systems affect how well the medications work. And also, sometimes the medications make the blood pressure go down and people feel bad. So that limits how many medicines we can put on each other. And sometimes there's other medical problems which these medicines could make things worse, especially if we get people dehydrated or hurt their kidneys. So there's many considerations on the medications. That's what this Barostim tries to change. So the Barostim is a technology that helps change the chemistry, especially the sympathetic and parasympathetic immune system. So it helps treat that. So it's used for a treatment for heart failure. It's also the parasympathetic nervous system can help, when it's stimulated, turn down the sympathetic nervous system, which is raising blood pressure. And of course, the lower blood pressure, the better the heart does as well. So far, the FDA has approved this device for use, and it's going to be used in the future in selected patients for both heart failure, in weak hearts, and high blood pressure. So I just wanted to give you that overview today about this Barostim technology. This is not a pill. This is not a medication. This is a new device that stimulates the body to make more of a certain type of stimulant, the parasympathetic nervous system, which helps change the hormones, which might help improve the heart, just like our pills. However, it doesn't have some of the side effects that pills and medications have in both lowering blood pressure and treating heart failure. Is this for everyone? Is this for anyone? Well, we're going to explore that and exactly what it is the next time we're together. But for today, I wanted to let you know, don't forget our text today, Psalms 103:19. The Lord has established his throne in heaven, and his kingdom rules over all. The Lord is in charge of everything. He allows this technology to exist. He allows people to discover new things. He allows rulers to be put in charge, all for his will. We might not understand why things are happening, but this text we can take to the bank, and there's many other texts like that. His kingdom rules over all that's going on our earth. And that assures me that we have a good plan for the future, even though we might not understand it. So please share this video with your friends and neighbors. They might benefit from this if they want to learn about advancing treatments in heart failure and hypertension. They might want to share it with their friends and neighbors. But one thing we all want to hold with us for sure today is that our Lord's in charge of this earth. His will be done. We might not understand where, how, or where, but that's something we can take to the bank. So I'm Dr. James Marcum. I'm going to be back yet soon with another biblical prescription for life. And next time we're together, I'm going to go into what the Barrow stem is exactly, how it's put in, who might benefit, who might not benefit, and whether it's due for prime time today. So join us next week for that discussion. I'm Dr. James Marcum. I'm going to be back soon with yet another biblical prescription for life.